So you're gonna be sitting however you wanna sit, and there's gonna be a couple different little soft tissue things that you may wanna try to help with your pain. So the first we talked about was just this joint mobilization. So for that, it's just to take your hand to grip the cup kind of the bottom of the heel, and you want some level of stabilization up here because the idea is to hold this steady and to move this relatively out that way. And then you're just gonna kind of wiggle your heel. So we talked about, like, the more surface area you have of your hand on the heel, the more likely you are to actually get the heel moving as opposed to just like your hand wiggling on your foot. And we also talked about comparing it to your other side if you're not really sure what you're supposed to be feeling because your left is more mobile. Okay. And then you can take this hand away, and we talked about just releasing some of the tissues here. It can be as simple as what you're doing now, where you're just kind of dragging the thumb along. We know that this is the area where you've sort of had pain and it'll be a little stiff in the morning. And so all of this stuff can kind of lock up over the day. We're just trying to encourage some motion through those tissues. And then you can do what's called a pin and stretch, which is to pick a point that feels a bit sensitive and hold there, and then try to evert your foot
that way,
and then come back. So it's always like starting from this like shorter position with a little bit of tension here, and then moving out. And that just encourages the motion, but also encourages a bit more stretch relative to this point. So those are all the little manual things you can try.